Hi, everyone. Ian Andrews back with you from LakewoodAlive. We're going to get started. We're at 10:02, and we want to make sure that we give our presenters plenty of time to not only run through their discussion points, but also to be able to answer your questions. So thank you again for joining us today. We really appreciate it. And this restaurant reopening webinar, we started talking about just how many questions there are swirling around about how to open safely, not just for the customers, but also for the employees or the staff of the restaurants, to make sure that everyone's health and safety is top priority. And while everyone certainly is doing everything they can, this is an all new, brand new ball game for everybody. So we hope this will be valuable to you. We also want to let you know that this is there's an opportunity to ask questions throughout. So please go ahead and click on the little question thought bubble. Type in your question. My colleague Allison Urbanik, our Housing and Internal Operations Director, is joining us. And she will gather the questions. We will ask after each presentation, and then we'll have just an open general question time at the end of the presentation. So let's go ahead and jump right in. So here's the agenda. We'll run through some of the programming that we've been a part of, trying to help small businesses during the pandemic. Introduce our panel. We'll go through the presentations and then general Q&A, as I said. LakewoodAlive has been partnering with the City of Lakewood and the Chamber of Commerce since beginning of March on tackling what we saw was coming, and then what happened with COVID-19 and the impact on small businesses, and just trying to be as helpful of a resource as we possibly can be. Those of you that have joined us on other webinars, this slide certainly is familiar. We've been able to host 7 webinars now in just about the last month and a half. We had never hosted a webinar before the pandemic, and now we're doing almost one a week, not only here, but then also we've hosted an additional 5 or 6 for our Knowing Your Home series. So we're hoping that being able to provide this education, albeit virtually, is helpful and beneficial to the community. We worked with the City of Lakewood on developing the rent relief program, which supported brick and mortar businesses, about 118 businesses, to the tune of $180,000 to support 1 month's worth of rent. And we hope that was able to help people out. Access to financial programs and resources, particularly with our financial institutions, including First Federal of Lakewood, that created an emergency bridge loan product for $2,500. If you have any questions about that, please reach out to me and let me know. That money is still available, and they're still lending. Deferred payment until January 1, no prepayment penalty, and you don't have to have an account with First Federal. They just want to get money out on the street. Creating a small business task force with the mayor. Mayor George has really shown a lot of great leadership in many aspects of this pandemic and has continued to focus on small businesses. We are coordinating merchant associations, working with the Downtown Lakewood Business Alliance, Uptown Lakewood, and then partnering with West End Lakewood to be able to keep those groups together and connected with one another. Connecting with expertise like we are, and then also making sure that we're connecting people individually with lawyers, CPAs, et cetera, to try to help them navigate. Working through PPP, idle unemployment, has been a task for everybody, and then advocacy with our public officials. Excuse me, and we've also had some really nice community solidarity initiatives like Lakewood Light the Night, Chalk Your Walk, just some fun things for people to get engaged and involved in and get through it together. So we're going to jump in. Representing Cuyahoga County Board of Health, Ashley Rominski is a registered sanitarian, and I've had the pleasure of working with Ashley for several years now. Ashley, if you wouldn't mind just saying a few words about yourself.
Hi, everyone. I'm Ashley. I'm the sanitarian for Lakewood. So I do all of the restaurant inspections and grocery stores and gas stations. A lot of you have seen and met me. You're always able to give me a call or send me an email if you have any questions. I'm here to help answer any questions that you may have, especially during this time.
Great, thanks, Ashley. And then representing the Ohio Restaurant Association, Todd Bowen is the Managing Director of External and Government Affairs. Todd, thanks for joining us. Wouldn't mind just saying a few words.
Absolutely. Thanks, Ian. Thrilled to be a part of this webinar today. Appreciate the work of LakewoodAlive and appreciate the opportunity to be on with Ashley. I was just saying to Ashley and Ian, as we were getting set up for this, the restaurants and the health departments really have always done a great job of working closely together, and I think even more so in the last couple of years. to make sure that it's a partnership between the regulated and the regulator, and I think that really does show through. Thrilled to be here representing restaurants and all the work that we're doing to help them get restarted and come through strong, and appreciate the opportunity.
That's great. Thanks, Todd. We appreciate it. So we're going to jump right in. Ashley, I'm going to queue up your presentation. Folks, if you'll bear with me for just one moment. So Ashley, go ahead. The floor is yours.
Can you hear me, Ian?
Loud and clear. Go right ahead.
Okay. So we're just here to talk about the responsible restart of Ohio, and that is regarding all the food service operations and retail food establishments. If you could get the next slide, perfect. If you guys have not read or looked at the Dine Safe order, I would recommend that you guys do that. You can find that on ODH's website. So we're just going to talk about some of the basics that are found in the order. So one thing that is extremely important is that customers must be seated when consuming food, beer, wine, and liquor on the premises. So I know the first weekend at the outdoor patios, there were some issues. It seems like this weekend there weren't as many, but we want to make sure that everyone's seated. So if you have tables and you have a bartender, you're not going to have the customer walking up to the bar to order. The hostess, waitress, or bartender is going to come to the table and they're going to get the orders for you. So that is something that is extremely important for your staff to remember, especially when individuals are consuming alcohol. When you have them going up to the bar, that makes them more able and liable to congregate and hang out when they need to be seated. We also want to make sure that everybody is keeping their 6 feet minimum distance between parties. That includes waiting and dining. So when we talk about waiting, I know that a lot of the restaurants have small areas for wait, especially in Lakewood. So it's recommended to maybe have people stand outside, wait in their car. You can also recommend that they call in for reservations. Now with the dining, you're able to seat a maximum of 10 individuals in one party. So if a party of 12 comes in, unfortunately, they cannot sit together at this time. So you'll have to do 6 and 6, and then those tables will have to be 6 feet apart. I know especially in Lakewood, there has been some challenges with spreading the tables and making sure that the 6 feet of distance is met. With the small bars and restaurants that are there, that means that maybe 50% of your tables can no longer be on the floor. So a lot of places have been very unique, and they've been doing plexiglass. They've been doing that at the bar seating for parties to separate them. I know that Dorita specifically had this plexiglass made that's on wheels to place between the tables. So if you guys have any questions about that, I would definitely contact Dorita. I'm sure that they would be willing to help you guys look at things. I know that Corky's has also done some plexiglass at their bar as well. We also want to talk about the private dining room. So if we have some of our restaurants have the private dining rooms, we still are under the mass gathering limited to 10 people. As of now, you have to follow that, and we can only seat 10 people. So you'd have to do it like the regular dining. You also need to post a list of all the COVID-19 symptoms for customers to view. It is highly recommended, but it is not required for you to ask each customer coming in if they're feeling symptomatic. So it just says that it's recommended in the order. You could go to the next slide, Ian. We want to make sure that we're performing all of our daily cleanings. That includes our front and back house. So we want to make sure that we're cleaning and sanitizing all the tabletops, chairs, and menus between seatings. So one thing that's very important is the menus. So we want to make sure that we're wiping those all down. If it's not a menu that can be wiped down, then it's going to have to be discarded after each use. So you want to make sure that that is happening, just because the menu's going into so many hands. We want to make sure that you're cleaning all the high-touch areas. That includes your door handles, your light switches, phones, the pens when they are signing their orders. You want to make sure that they're also cleaning the touch screens and the pads. And you want to be doing that every 2 hours or more frequently as needed. So that is in the order. And you also want to make sure that your sanitizers are at the required concentration. And you want to make sure that they're effective against COVID-19. I know that doing a lot of my restaurant inspections, sometimes I'll go in there and I'll be using my touch strips, and the sanitizer is at 0 parts per million. So we want to make sure we have those touch strips there and that we're using them to make sure that we're sanitizing them and that it's effective. And I also have a link on there, and it gives you a cleaning checklist and all the sanitizers that are approved by the EPA that are effective against COVID-19. You also want to make sure that you're removing all your self-service table and common area items. So this includes your table decor, if you have vases, candles, anything like that that sits on the table, any of your creamers, your salt and pepper shakers, your condiments. At the gas stations or grocery stores, the customer can't do any self-service items. So they can't go to the bulk donut cases or the hot dog rollers or the coffee or a cappuccino machines, the fountain beverages. So that's one thing that's very important, that we make sure that we're not doing any of those self-service items that are specified in our order. We also want to make sure that our open congregate areas are to remain closed if they're not used for dining purposes. So I know some bars have their pool tables and their arcade games, and they have dancing. So at this time, with the Dine Safe order, you're not able to do anything like that. They have over the weekend stated that live music is allowed. So with live music, you have to make sure that the performers are 6 feet apart from each other and following all the social distancing requirements. And you could go ahead and go to the next slide. All right, and we want to talk about the employee requirements. So the most important 2 things is maintaining our social distance and wearing our facial coverings. So we want to maintain our social distance when possible. So especially in Lakewood, we have extremely small restaurants. So what we want to make sure is that our employees are trying to maintain their 6 feet of distance. Now, sometimes the employee might be slicing something at the prep table and an employee needs to get in the prep cooler below. That is where the where possible comes into play. So we don't want people to be standing next to each other for a long period of time, but if they need to pass by or if they need to get something, then at that time they could. We also want to make sure that all employees are wearing facial coverings. So I know right now that is a hot topic, and we have our COVID phone bank, and that's one of the main complaints that we are getting for restaurants, is that they're not wearing their masks or they're not wearing them properly. So we want to make sure that we're wearing them properly. So you don't have to wear a mask. It has to be a facial covering. So it needs to be some sort of fabric that's covering your nose, mouth, and chin. And you want to make sure that anytime you touch your facial covering, that you're then washing your hands just like you normally would if you touched your face or switching a task at your restaurant. So what we want to make sure is that you guys stay safe and you stay open. If customers come in and they see that employees are not maintaining their social distance or they're not wearing their facial coverings, they're not wearing them properly, that might make them indicate that they're not doing things properly here at this restaurant that I'm seeing with my eyes, and I don't know what else they're doing behind the doors. That may lead them not to come back. And we want to make sure that they feel safe as the customer and they want to come back. You guys are small businesses and they want to help you guys get through this at this time. We also want to make sure that the staff is taking their temperatures. So it's not required as the employer to take temperatures. However, the employee needs to take their temperature before coming into work. So I know a lot of restaurants right now are just doing the temperatures when they come in, which is great, and some are doing them throughout the day. You also want to watch out for coughing or trouble breathing, and if you have any issues with that, you should let your manager, supervisor, or the owner know immediately. My computer just went to sleep, so bear with me.
Actually, we were at the part where we're seeking to actively encourage sick employees to stay home until they're free from fever for at least, without the use of medication for at least 72 hours, so basically 3 days, and the symptoms have improved for at least 72 hours, and at least 7 days since 7 days have passed since symptoms first began. So I don't know if there's anything else you want to add about that, and then contacting local health district, which would be you, right?
Correct, yeah. So what we have is we have our COVID phone bank here at the health department. So I don't know if anybody wants to write down this number. The phone number is 216-201-2090. So if you call that number, there is usually 4 to 5 people manning the phones there, and they're answering any type of questions that you may have related to COVID-19. So sometimes that is a little more efficient to call that number than your sanitarian, because the sanitarian might be out in the field. They're following up on all the COVID complaints. So if you definitely need an answer right then and there, I would recommend that you call that COVID line, and they would be able to help answer your questions. Now, not always they might not be able to answer because they might not be familiar with your facility. So they might state, you know, this is what it states, but what we would recommend is talk to your sanitarian. But the most important thing is contacting us when there's a confirmed case or a suspected case. So that way we could try to help you guys. What we don't want is a cluster to happen. So a cluster is when multiple people at a restaurant or a facility becomes ill and shows symptoms. We don't want 5 employees to become ill and then maybe our customers have now been susceptible to possibly being a close contact. So we want to ensure that everyone's doing safe and maybe look at any type of items that we can correct there if we're seeing anything that needs to be corrected. And I think you can go ahead to the next slide.
And that was it.
And that is, yep. And if anybody has any questions, they can let Allison know. They could also give me a call or email me or contact our COVID phone line.
Okay, thank you, Ashley. I do have a few questions for you. Our first one comes from Jeff. He's asking, we have a common restroom that is maintained by the building, and it is often a problem having them keep it up. What recourse do we have if they fail to uphold their end of the obligation, and we have to use our own labor and chemicals to ensure we comply with frequent cleaning orders?
What I would do is, the restroom has to be cleaned, and it should be cleaned every 2 hours. So if you're paying rent and you're in a facility, I would speak with the landlord about it. If the landlord is not doing that, what I would say is contact your sanitarian or your health department on that COVID line and tell them that you share a restroom in a common area and they're not cleaning the restroom how they're specified to do. So I'm pretty sure I know where this place is. So there's a couple restaurants and it's also an office building setting. So office building settings are also required to clean all their high contact surfaces, which includes the bathroom. So they have to comply whether it's an office area or a restaurant facility, so they have to do that cleaning.
Great, thank you so much. We have our next question from Rachel. Rachel is asking, concerning mass gatherings, I thought they had lifted as long as groups were seated and treated same as dining. Could I get some clarification?
So the Dine Safe order is in effect right now, and that says that the mass gathering is limited to 10. So I know that the governor had mentioned last week about weddings and the catering locations being allowed to have 300 people, and that's if they maintain social distancing, the same as restaurants. So you can only have 10 people at a table. Each table has to be 6 feet apart, which is extremely hard to do if you're a restaurant, because you have to have a very large space to be able to fit 300 people at 6 feet apart. And then they also have to comply with everything as the restaurants do. So there's no congregating. So if it's a wedding, there's no dancing. They're sitting at the table and they're drinking and eating at the table. So they're not allowed to be walking around, dancing, or anything like that. As of now, we have not received that order. That order goes into effect on June 1st. And normally how we get the order, we usually get it the night before it goes into effect or the morning of. And that gives us a little bit more specifics. But that is all that was addressed during the press conference last week.
And Ashley, this is Todd. I'll add to that. They have not updated the Dine Safe Ohio order yet, but on the coronavirus.ohio.gov, the Responsible Restart Ohio for bars, restaurants has been updated to say bars, restaurants, and event and banquet centers. It has at least some guidance in there that folks could take a look at.
Thanks, Todd.
Great, thank you. And Rachel, if you have any additional questions about that, feel free to reach out to Ashley directly, or feel free to submit another question. Okay, so our next question is about kitchen staff and facial coverings. Jessica has a question about them. She's been hearing some contradictory things. So Ashley, if you could explain regarding kitchen staff wearing face coverings, please.
Okay, so with the facial covering, so all employees are required to wear them. However, there is an exemption, and they can take a look in that safe order. So it has a section about masks. So in that order, it states that exemption can be made if the employee is working over a hot stove, a hot fryer, a hot oven. However, if that employee leaves the stove, the fryer, or the oven, and then goes to maybe the prep table or going to do dishes, they then have to put on a mask because they are changing jobs. So when they're in those areas, they do not have to wear a mask just because it is hot and it is hard to breathe with the mask on with the heat. However, when they leave those jobs, they have to put their mask back on.
Okay, great. And then to follow up on that, we also have a question. So when people are leaving the dining area or the kitchen area, they normally take off their aprons and gloves. Should they leave their masks on while going out, maybe either into common areas or to the restroom? And then what's the sanitary methods on that, keeping everyone clean and safe?
Yeah, so they do have to leave their mask on because all of the waitresses, the hostess, the bartender, they're going to have masks on too. So it's not just the kitchen staff. And it goes back to the customer and what they observe. If they see that an employee is not wearing their mask, they're going to call. We've seen it in the phone bank. They're not afraid to call when they see that someone is not wearing their mask or not wearing it properly. Now, if the employee is on their break, obviously they have to eat and drink, so they have to take off their mask. So that is allowed.
Okay, and then just one more, and this is pretty specific, but just to ensure that everyone is clear, does the dishwasher have to wear a facial covering even if they're in their own room?
So if they're if they're in their own room, that means they're in a room that specifically only has the dishwasher and there's a door that you have to get into. So if it's a completely separate room that's not open area to any other room, then no, they do not have to wear it. But if it's open and you could see into the cook line or the ovens, that's not considered a separate space. And then also if they're in a separate room and they're working with, if there's two individuals in there, then they have to wear it because there's more than one person.
Great, thank you. I have one last question, and it is from Jeff. The 6-foot rule while seated or waiting seems fairly easy to understand. Are there any suggestions for dealing with walking spaces, especially bottlenecks like entrance, exits, and restrooms?
So what I've been telling a lot of people is to put markings on the floor. So you could do a simple tape marking. What I've been seeing is if people have markings, they know where to stand. Sometimes people are a little edgy and a little defensive. If they don't know where the 6-foot mark is, they're going to say, I don't know how to measure 6 feet, and there might be an issue there. So if you do the markings, it makes it a little easier. Now with the restrooms, that becomes a little difficult. You just have to try your best. You could do the markings. As everybody knows, not everybody reads everything and not everybody does anything, but we want to try our best to try to maintain our customers. Although not all of us want to do that, it is part of the order that you have to be able to control the customers and make sure that they're maintaining their social distance. So I know that over the weekend when the patios had opened up, I know that some restaurants stated that some of their customers moved their tables together and then there was a larger group. So you got to make sure that they're not doing that.
Great. And we have one final question, and I believe we can move on. Danielle is asking, masks keep customers safe at bars and restaurants, but what is to keep bartenders and servers safe?
So that is up to the governor, and ODH has left that up to each individual restaurant. So all employees are required to wear masks, and then it's up to the restaurant if they want to have their customers wear their masks. So I know that becomes difficult because it's not like going to a retail or a grocery store, people are eating. In the order, it does state that they recommend that the customers come in wearing a mask and then they remove their mask while eating. So you guys can definitely recommend that if you want to. You guys could put up some barriers between, I know that there has been questions about the bartender. If people are sitting right at the bar, you don't have to have people sitting at the bar if that's a question of your concern.
Great, thank you so much. We're all caught up on questions, Ian. We can move forward.
Great, thanks, Allison. Thank you, Ashley. We're going to go straight to Todd Bowen, representing the Ohio Restaurant Association. So, Todd, go right ahead and take it away and let me know when you want me to advance the slides.
Awesome. Thank you, Ian, and thank you, Ashley, for that great talk through of the Dine Safe Ohio order. That was very well done, and I'm sure very helpful to all the restaurateurs that are on the webinar today. What I really want to do is just talk through what the Ohio Restaurant Association has been doing through the coronavirus, and I think it's both a public health and an economic crisis, and then some of the resources that we have available, and then kind of where we're putting our energy now and where we will be putting our energy going forward. So on March 15th, as we all know, dine-in was closed. The Ohio Restaurant Association kind of immediately put all of our energy and resources into helping restaurants, really know what is going on, help them survive this crisis, and then ultimately the goal to help restaurants come back and revitalize our economy and help our communities emerge as strong as possible on the other side. And while we're not on the other side now, we are much closer than we were 2 months ago or a month ago. So we've made sure that as the crisis has gone through different steps, we've been right there to help our restaurants every step of the way. And that really started right at the very beginning. We were on the front lines fighting for carry out and delivery to be included as an essential service. Initially, the governor's office was not looking at it as such, but we really made that point to them. And I think everybody in a restaurant world knows this, that right now in America, 51% of the US food dollar comes through restaurants. So we're really essential to, not just to our communities, but to feeding our communities and very much also feeding those kind of first responders, the healthcare workers, the police and fire. Drive-through was very essential. And after we made that point to the governor, they really embraced it. And I think if you would remember back to those early press conferences, he would often say, hey, make sure you go out and support your restaurant and get carry out today. The first slide was our website, and just our website is just www.ohiorestaurant.org. And we've got a wealth of resources there. So if you have not been there, check it out. We've got a lot of resources there. And then next slide, Ian. One of the key things that we've done as reopening has begun to happening is create this Ohio Restaurant Promise. So really beginning in late April when talk of setting some sector-specific reopening guidelines began, we really strongly began to advocate for restaurants being A, given a date, and B, given guidelines that really took into account and understood how restaurants actually operate. The governor's office and the lieutenant governor did reach out to us, asked for some suggestions for their restaurant advisory group, and they wanted to make sure that that restaurant advisory group that they put together, which really came up with that Responsible Restart Ohio mandates and recommendations document that you'll see on the state's website, was both geographically diverse and then size, sector, and scope diverse. And I will say we work closely with other state restaurant associations, and while from a restaurant operator's standpoint, there's a lot that you do have to do to meet those mandates and guidelines, but they really do make a lot more sense from a restaurant operator's standpoint than a lot of them that I've seen in a lot of other states. And we fought very hard for that, and we did appreciate the many restaurant folks that really pitched in and helped make that happen. When you look at our Ohio Restaurant Promise, what the point of the Ohio Restaurant Promise is, we're suggesting that restaurants actually print out either the seal or that front page, and you can again find that on our website. And what you're saying by posting that is, we are a restaurant that takes this seriously. We will be a leader on safety and a leader on meeting all mandates. But there is also a customer patron facing part of this. And it's saying to the patron, your pledge is that, number one, if you're sick, you won't come in, you'll use our carryout or delivery. And number two, you will understand and gladly and willingly meet what's expected of you to meet these guidelines as well. Because we certainly know that being allowed to operate is only the first part. The second part is kind of instilling that consumer confidence. We certainly understand that there's probably about 25% of the population that the minute a restaurant opened, or really any sector opened, they wanted to be out and as much as they were allowed, be visiting restaurants. And then there's another 25% that's going to be very reluctant to come back, and some of them probably for legitimate reasons. They might be an at-risk population, but for that vast majority in the middle, they're going to come out at the pace that we make them feel comfortable. So that's one of the points of the Ohio Restaurant Promise, is it's helping to instill consumer confidence, both in the restaurant industry as a whole, and then in your specific restaurant as well. Because you want, when somebody comes, them to leave and say, that's a restaurant I want to come back to again. I really did feel safe and comfortable there. And also I want to tell my friends about it. So that's what the Ohio Restaurant Promise is all about. Next slide, Ian. And so we certainly know that having the promise isn't enough. So the rest of that Ohio Restaurant Promise website is really dedicated to having some resources to help restaurants succeed. And one of the key ones there is this PPE, and we've both got some guidance on PPE, and then we've got some great resources where restaurants can find that. We know that Sometimes your regular broadliner might have plenty of resources, but that is not always the case. So we want to make sure that there's a place where you can find the PPE that you need, the sanitizer, the face coverings, everything else that is required. Next slide, Ian. And then some of the other resources that we've put up on our website, we've had webinars on a regular basis, and they've ranged from, we had the restaurant advisory group on, and they talked through the guidelines and kind of their thinking as they developed the guidelines. We've had elected officials on to make sure that they understand the unique challenges facing restaurateurs. And then one that we had recently that's highlighted here, and these are all, we do them both live and then they're archived on our website, is we really had a great public relations pro come on and just kind of talk through from a guest engagement perspective, what do you want to do, not only to meet the guidelines, but to make sure that your guests know that you're doing that. And then really, how do you react when you might get somebody complaining about something that you're doing, and how do you take that seriously and instill that consumer confidence? So that would be one that even now would be worth your time to go on and watch that webinar. Really had some great points on there. And then we certainly wanted to make sure that there were some Dine Safe Ohio resources. So we've got some signage that you can print out. I know the local health departments do a great job of that as well, but we wanted to be one more place folks could find the signage. And then we've also worked very hard to push these out on social media as well, because we know not only do restaurants need to know this, but we want to make sure the public to the greatest extent possible knows what to expect when they go into a restaurant, so that which helps them feel comfortable as well. Next slide. And then something we've been very committed to from the very beginning is being kind of the information resource for restaurant owners and operators. And we put out a daily memo, and this just happens to be the day's daily memo, the day that I put this presentation together. But this is the kind of the table of contents, so it'll give you an idea of some of the things that we make sure that we talk about on a regular basis. We just know that there is so much information coming at people right now that we wanted to be a resource where you could look at this and say, we know that this information is coming through a restaurant operator's lens. So you can go to our website, you can sign up to get our daily memo. We are a membership-based organization, so if you're not a member of the ORA, we would appreciate you becoming a member. This helps us do these things for the industry. But right now, we are making all of our resources available to the industry as a whole. So I would strongly suggest that you go on, sign up for these updates, just kind of take a stroll through our website. And then Ian, next slide. And then we've certainly never taken our eye off of the advocacy ball. One of our primary roles is, as I mentioned before, making sure that elected officials at every level of government understand the unique challenges that restaurateurs face. So these are just a few selected things that we've done, but we've probably, between state, local, and federal, sent hundreds of messages, memos, letters, talking points to our elected officials, and they've listened very well. I will certainly say I have found, by and large, Ohio's elected officials at every level to want to know what our restaurateurs are facing, and to do to the greatest extent they're able to be helpful. Two issues that we are really pushing on significantly currently are changes to the Paycheck Protection Program that was in the CARES Act. We know and appreciate that the federal government wanted to be helpful to businesses that were impacted by the coronavirus, but there were some provisions in the Paycheck Protection Program that really didn't work for restaurants who were either closed down or operating minimally. So the three changes we are pushing for every day are a change in that 8-week period that you have to spend the dollars that you got from the Paycheck Protection Program, as restaurants are really just now getting opened, and even now will be operating under the Dine Safe Ohio guidelines that will keep your capacity a little bit lower. And then also, the other that we're pushing for is changes to the 75-25, so that more of your dollar could be spent not necessarily on payroll. We know that restaurants, payroll is a significant expense, but your rent, your supplies, all play into it, and it may not exactly fit that 75-25 mix. And then thirdly, we have made an argument that the 2-week term on the part that is not forgiven and becomes a loan should be, a 4 or 5 year term minimally, and we've really pushed for a 10-year term. We know if we could get 2 out of those 3 changes made, it would make the Paycheck Protection Program work significantly better for restaurateurs. We believe there's likely to be a House vote today or tomorrow on a standalone bill that would do many of these things. And I know our Ohio members of Congress are very supportive of those changes. And then the next will be to try to get something through the Senate. So that's something we're fighting for every day. And then we're beginning some kind of forward-looking at the State House. In fact, I'm heading over to the state legislature a little bit later to advocate for some alcohol serving flexibility bills that would allow, for instance, the 2-drink carryout to be extended, codified, and made permanent. We know for a lot of restaurants that was very helpful. And as even before coronavirus, delivery and carryout was becoming a bigger part of many operators' models. That we want to make sure that some of the things that they did to help through this crisis, when they make sense, are made permanent. And then we know that Lakewood and many other communities are doing great things to allow some additional outdoor seating, and we are pushing for, we know that for that to work financially for restaurants, alcohol has to be allowed. And the Ohio Department of Liquor Control has done some things in the interim to try to help with that, but we want to make sure that those are not just kind of individual decisions, but we're pushing that those be put into law. Next slide, Ian. And then certainly you'll just see some pictures here from the day that restaurants were allowed to reopen. We have been out visiting our restaurants, answering questions, trying to help them do it excellently, but then also pushing out to the public that restaurants are doing this excellently. Restaurants are serving their communities. So the picture in the patio with the onion rings, that is our chairman, Sam Lindsley, who's a Cleveland guy that some of you may know, and Larry Obhoff, who's the president of the Senate. They made a point of the first day restaurants were open, going out and visiting some in Medina. And we're just, we're committed to doing that, making sure that restaurants do it well and that the dining public knows that restaurants are a great place to go and enjoy and support your communities. Next slide. And then from the very beginning, we've obviously, as the Restaurant Association, we support owners and operators, but we also support the entire restaurant community. And that includes the restaurant employees who were very, many of them laid off and furloughed. So we created a restaurant employee relief fund and have been raising money from folks who just wanted, a lot of people say, hey, I go in and my restaurant servers have always taken good care of me. While they're laid off, what are some things that I can do to take care of them? So through the Restaurant Employee Relief Fund, we've been able to raise significant dollars and then support a lot of restaurant employees, some while they were waiting for their unemployment to kick in, or sometimes they just had some emergency things come up. And we are still doing that. We know that a lot of restaurant employees are coming back to work, but not everybody's coming back to work the day this was open. So there's going to continue to be a need. So this is something we're going to continue to push for. And then this Saturday, there's going to be a Facebook Live tip jar event. It's going to be a concert. So go check out our ORA Facebook page. We're a great follow on social media, but this is something that you could push out to your patrons to say this is a way that you can support the restaurant industry and restaurant employees as a whole. So I appreciate the opportunity to be on, appreciate Ian having me, and certainly be glad to take any questions that anyone might have.
Great, Todd, thank you so much. We do have a question here asking from Laura, how do we determine the maximum number of folks who are allowed to be in our restaurant?
Yeah, so the state of Ohio, many states actually set a 25% or a 50% or a 33% capacity. What Ohio did is said, here are the guidelines. You have to either through a physical barrier or creating the 6-foot social distancing between tables. But if you maintain those social distancing, then you can figure out what the maximum capacity is for your restaurant. So what you want to do is you want to carefully think through that, make sure you're meeting all the guidelines, and then you want to actually post that number, and that's both for the public and for your health department. Ashley did a great job of talking through the health department's guidelines and what their role is, but I would say to a restaurant owner and operator, what you want to do is you want to think through any questions that you think your sanitarian might ask you, and have the answers written down so that they may not necessarily agree with every answer, but they will very much appreciate that you're thinking about this and taking it seriously. So it does give you, the way Ohio did, it does give you the freedom to come up with what your number is.
Great, thank you so much. So if anyone has any additional questions, feel free to submit those. I'm going to turn it back to you, Ian, temporarily while we wait for any additional questions.
Thanks, Allison. Todd, I do have a question, and I'm glad you brought it up. PPP relative to restaurants. This wasn't necessarily designed for restaurants that are closed, or even if they were doing limited carryout. They didn't have their entire staff. Can you just talk briefly about maybe expand a little bit more on some of those points you were making, especially I think trying to extend the term, which is something that I brought up with a local financial institution, would be really helpful. But maybe some of the things that that you're hoping to be able to achieve in any way that we could possibly help.
Yeah, absolutely. So, one of the points that I make in every conversation I have with a legislator is, when they were first passing the CARES Act, I think most Americans, most Ohioans kind of thought that this coronavirus was something that was going to be an issue for us in March and some part of April. It was not something that we or our elected officials expected to be, on May 27th, we're really just starting to be allowed to reopen. And even then with some significant requirements that we have to meet. So I said, well, it's very natural then that you come back and say, okay, how do we fix this and make it work for businesses that were either shut down or operating very minimally? And as I said before, in Ohio, they've been very receptive to that. I think the PPP worked very good for businesses that were operating at, say, about 80% of their capacity. But for those that were operating at 20%, or for some restaurants that just carry out didn't work for them, not operating at all, it didn't work because you have to spend the dollars. Your 8-week window starts the minute you get that first disbursement. And you have to spend 75% of it on payroll. So if you don't have employees in, that's very difficult. So number one, and I think we're getting some headway on this. We have said instead of it being an 8-week window, you have to spend that money. It should be. We've advocated for a 24-week window. And then the other thing is, if you didn't extend the window, at least push back the date and let the restaurant choose what their starting date is, as opposed to it being the date that your disbursement is set. And then changing the 75-25 to, we've advocated for 50-50, I think would make a big difference and be more reflective of what restaurants actually are. And then we do know that even despite the best efforts and some of those changes, that some of the loan might not be forgiven. And thankfully, it is only a 1% loan, which is great. But the last thing restaurants need right now is more short-term debt. So we've advocated for that to be. We've advocated for a 10-year time frame. We've had some members of Congress say they don't think they can get to 10, but maybe a 4 or 5 year term. And as I said, the House is voting on a standalone bill either today or tomorrow. And if they are able to pass that, that will give us some great momentum to really push for the Senate to do that as well. There have been other fixes, but they've been included in other bills that had some more controversial measures. So I'm thrilled that there's now a standalone bill that might do this.
That's great. Thank you, Todd. And if it's helpful at all, one of the conversations I did have with a local community bank was around the idea of the bank essentially helping to refinance the loan on behalf of the client and then be able to extend it out a couple of years on their behalf. So just kind of food for thought, but I appreciate your help with PPP.
Absolutely.
Allison, do we have any questions?
Ian, yeah, we have one final question, I believe, and it's from Danielle, and Danielle is asking about karaoke. And is karaoke safe and permitted at this time at bars?
Currently, karaoke is not permitted. Is permitted, but karaoke is currently not permitted. And we are having ongoing conversations with the Restaurant Advisory Group and the Lieutenant Governor's Office on some things that might be included in the next phase, but it is not included right now.
Todd,
Ashley, anything you want to add?
Yeah, so as a county, we have decided that karaoke is allowed to take place, but they have to do it safely. So what we're stating, karaoke is just like the live musician. So if they have one person up there, they need to be 6 feet from everybody else. Or if you have 2 people up there, 6 feet from each other. And they have to be separate. And then the mics have to be sanitized. I know that some people are sanitizing their mics, and then they also have these foam covers that each customer is to keep. So if they want to karaoke multiple times, they will put it back on the mic, but the mic will be sanitized, and then they're supposed to be switching mics interchangeably. So I know that this is something that came up this week at our office, especially with the live entertainment. So we have permitted it as long as they're following those guidelines.
Yeah, excellent. We appreciate that, Ashley, and maybe you can share that with some of the other counties as well as a best practice that they could look into.
Sure.
Ian, we do have an additional question, and I'm not sure we'll be able to get this answered through here. And Jessica, if we can't, we will definitely follow back up with you personally. But a question we have is, can you tell me if employees are still allowed to receive unemployment while being employed under the PPP program?
So you're saying can you bring an employee back and they still receive unemployment? I guess the answer to that would be that no. If an employee comes back, they would not be eligible for for continuing to be on unemployment. And one of the things I've really advocated to restaurants, because I know you're going to come back and it might be slowly, and especially with the additional federal dollars that went into unemployment, that there might have been some employees that were reluctant to come off of unemployment if their job was offered. But unemployment has always been designed to be a stopgap. And certainly restaurant employees, want their job to be there, their restaurant to be there and thrive and to be a job for years to come, and not just something that might be getting them through the next month or two.
Hey, Todd. Something that we've heard from folks specific to this question, though, is that they are being, quote unquote, brought back under PPP, yet they aren't really working. And so they've applied for PPP and received it. Now what they're going to be doing is paying their employees, but there's nothing for them to do, or at least some of them, there's nothing for them to do. So they're paying them through PPP at a rate that is less than what that employee is getting through unemployment. I think that's where folks are really trying to figure out how to make sure their employees are in the best situation, while also not necessarily, turning them in, but trying to, make sure that they're set up for success. So that's one of the biggest challenges, is the dynamic between the unemployment payout, especially the extra $600, versus PPP for someone who really doesn't have anything to do, but is going to be paid anyway.
Yeah, I do get that issue, and hopefully, as restaurants, I think hopefully that was an issue that was more prevalent 2 weeks ago, and as reopenings begin to happen, that may naturally help with that. But certainly that idea of as you offer your employees their jobs back, that hopefully they understand the reason they'd want to come back as well.
One would hope, but unfortunately it hasn't been quite that easy, but I certainly understand that.
Yeah.
We do maybe time for one final question, anything, especially for Todd from the Restaurant Association, or Ashley with the Health Department. I know we had 1 or 2 folks join us a little bit late. We had one issue, and I'm glad we were able to resolve that, Michelle. So if there's any final questions, and then we do have a hard 11 o'clock stop to let our panelists move on. In the interim, Ashley, any final thoughts to add? Go ahead. Go right ahead.
I would just remind everybody that if they have questions, they can absolutely give me a call. They have my email or my phone number, or to contact the COVID phone line here at the Health Department. Again, the COVID phone line number is 216-201-2090. So that is where somebody can give them their answer or help them with a question that they may have immediately, instead of being sent into my voicemail until I can get to it.
Thank you. Allison, any final questions?
We are all caught up. Thank you guys for such wonderful questions and helping to make this conversation great. And I do want to just say thanks to the panelists for a wonderful presentation.
Thank you. We appreciate it.
Great.
And
Thank you,
I'm glad
everyone. We will thank you both, and thank you, Allison. We will send out a follow-up email to everyone. We'll include a recording of this session, and please, any questions that you have, feel free to please let us know. We will make sure to share the contact information for our friends who are on the panel. And then briefly, as we just wrap up, we wanted you, if you have any questions for us, please feel free to reach out to me. There's my email and phone number, 216-521-0655. While the office is still closed, we're looking at a reopening of the week of June 8th. We are still working now more than ever, and the phones directly transfer to our cell phones. So we'll be happy to take your call or send me an email. Also, our friends at the Chamber of Commerce, Patty Ryan, who is on this webinar, please reach out to Patty. And then Caitlin Milius is our city planner, who's been doing a wonderful job in so many respects. And so thank you all for being with us today. We appreciate it. We wish you the best. Look for a note from us, and good luck as you reopen. To Ashley and Todd, thank you once again. Okay, have a great day, everyone.